Abilify, an antipsychotic medication, is commonly used in the treatment of various mental health disorders. Understanding its mechanism of action is crucial in comprehending how it works to alleviate symptoms and promote mental well-being. With its active ingredient, aripiprazole, Abilify functions by targeting specific neurotransmitters in the brain. It acts as a partial agonist, meaning it can either activate or inhibit certain receptors, depending on the brain's requirements. By modulating dopamine and serotonin levels, Abilify helps to restore the balance of these neurotransmitters, which are known to play a vital role in regulating mood, thoughts, and behavior. This mechanism of action also contributes to Abilify's efficacy in treating conditions such as schizophrenia, bipolar disorder, major depressive disorder, and even autism spectrum disorders. While Abilify's exact mechanism of action is not fully understood, ongoing research continues to shed light on its potential therapeutic benefits. Its unique profile, coupled with its wide range of indications, makes it a valuable medication in the field of mental health treatment. Consulting a healthcare professional is always essential to determine the appropriateness of using Abilify for individual circumstances. What is the mechanism of action? Abilify's mechanism of action involves its interaction with specific neurotransmitters in the brain. Neurotransmitters are chemical messengers responsible for transmitting signals between nerve cells. The two primary neurotransmitters targeted by Abilify are dopamine and serotonin. Dopamine is involved in various brain functions, including motivation, reward, and movement. Serotonin, on the other hand, plays a crucial role in regulating mood, appetite, and sleep. Abilify acts as a partial agonist for dopamine and serotonin receptors, meaning it can either stimulate or inhibit these receptors, depending on the brain's needs. This unique property allows Abilify to restore the balance of these neurotransmitters, which may be disrupted in certain mental health conditions. Understanding mental health conditions. To fully appreciate Abilify's mechanism of action, it is essential to have a basic understanding of the mental health conditions it is commonly prescribed for. Schizophrenia, for example, is a chronic psychiatric disorder characterized by disturbances in thinking, perception, emotions, and behavior. It often presents with symptoms such as hallucinations, delusions, disorganized speech, and cognitive impairments. Bipolar disorder, on the other hand, is a mood disorder characterized by episodes of mania, elevated mood, increased energy, and depression, low mood, loss of interest. Major depressive disorder is a prevalent mental health condition characterized by persistent sadness, loss of interest, and a range of physical and cognitive symptoms. Autism spectrum disorders are neurodevelopmental conditions that may present with challenges in social interaction, communication, and repetitive behaviors. Abilify has been found to be effective in managing symptoms associated with these conditions, offering hope to individuals and their families. How Abilify affects neurotransmitters in the brain. Abilify's mechanism of action involves its ability to modulate dopamine and serotonin levels in the brain. Dopamine is often associated with pleasure and reward, but an imbalance in dopamine levels can lead to symptoms of psychosis. By acting as a partial agonist for dopamine receptors, Abilify can either activate or inhibit these receptors as needed, helping to restore a more balanced dopamine system. This can alleviate symptoms of conditions such as schizophrenia, where excess dopamine activity is believed to contribute to hallucinations and delusions. Similarly, serotonin plays a crucial role in regulating mood, and abnormalities in serotonin levels are associated with various mental health disorders. Abilify's interaction with serotonin receptors helps to restore the balance of this neurotransmitter, promoting a more stable mood and reducing symptoms of depression and other mood disorders. By modulating both dopamine and serotonin levels, Abilify offers a comprehensive approach to addressing the complex neurochemical imbalances seen in various mental health conditions. The role of Abilify in treating schizophrenia. Schizophrenia is a severe mental health disorder that often requires a combination of medication and psychosocial interventions for effective management. Abilify has shown efficacy in the treatment of schizophrenia by targeting the underlying neurochemical imbalances associated with the condition. As mentioned earlier, excess dopamine activity is believed to play a role in the development of symptoms such as hallucinations and delusions. Abilify's partial agonist activity at dopamine receptors helps to normalize dopamine levels, reducing the severity of these symptoms. Additionally, Abilify's interaction with serotonin receptors may contribute to its antipsychotic effects, as serotonin dysregulation has also been implicated in schizophrenia. The precise mechanism by which Abilify exerts its antipsychotic effects is still not fully understood, but its ability to modulate both dopamine and serotonin neurotransmission makes it a valuable option in managing this complex disorder. The role of Abilify in treating bipolar disorder. Bipolar disorder is characterized by episodes of mania and depression, which can significantly impact an individual's quality of life. Treatment typically involves mood stabilizers to manage the manic episodes and prevent depressive episodes. Abilify has been approved by the FDA as an adjunctive treatment for bipolar disorder. It can be used in combination with other mood-stabilizing medications to help stabilize mood and reduce the frequency and severity of manic episodes. Abilify's partial agonist activity at dopamine and serotonin receptors is believed to contribute to its effectiveness in managing bipolar symptoms. By restoring a more balanced neurotransmitter system, Abilify can help individuals with bipolar disorder achieve greater mood stability and improve their overall well-being. Abilify as an adjunctive treatment for major depressive disorder. Major depressive disorder is a challenging condition that affects millions of people worldwide. While there are various treatment options available, some individuals may not respond adequately to standard antidepressant medications alone. Abilify has been approved as an adjunctive treatment for major depressive disorder, meaning it can be prescribed in combination with an antidepressant to enhance its effectiveness. By targeting both dopamine and serotonin receptors, Abilify can augment the effects of antidepressant medications, potentially leading to improved outcomes for individuals with treatment-resistant depression. However, it is important to note that the use of Abilify as an adjunctive treatment should be carefully considered and monitored by a healthcare professional, as individual response and side effects can vary. Potential side effects of Abilify. Like any medication, Abilify is associated with potential side effects. Common side effects may include nausea, vomiting, constipation, dizziness, and headache. Some individuals may also experience weight gain or metabolic changes, which can be managed through lifestyle modifications and close monitoring. Less common but more severe side effects may include extrapyramidal symptoms such as involuntary muscle movements, tardive dyskinesia, and neuroleptic malignant syndrome. It is important to discuss any concerns or side effects with a healthcare professional who can provide guidance and support in managing them. It is also essential to adhere to the prescribed dosage and follow up with regular appointments to monitor the medication's effectiveness and minimize the risk of serious side effects. Considerations and precautions when taking Abilify. Before starting Abilify, it is crucial to discuss the medication's potential benefits and risks with a healthcare professional. They will consider individual factors such as medical history, current medications, and specific mental health condition to determine if Abilify is an appropriate treatment option. It is important to disclose any known allergies, previous adverse reactions to antipsychotic medications, or any other relevant medical information to ensure the safe and effective use of Abilify. Regular follow-up appointments are necessary to monitor the medication's effectiveness and to adjust the dosage if needed. It is also important to avoid abrupt discontinuation of Abilify, as this can lead to withdrawal symptoms. Any concerns or changes in symptoms should be promptly discussed with a healthcare professional for appropriate management. Conclusion and final thoughts on Abilify's mechanism of action. Abilify, with its active ingredient aripiprazole, has a unique mechanism of action that involves targeting specific neurotransmitters in the brain. By modulating dopamine and serotonin levels, Abilify helps to restore the balance of these neurotransmitters, which play a crucial role in regulating mood, thoughts, and behavior. This mechanism of action contributes to Abilify's efficacy in treating conditions such as schizophrenia, bipolar disorder, major depressive disorder, and autism spectrum disorders. While the exact mechanism of action is not fully understood, ongoing research continues to provide insights into Abilify's potential therapeutic benefits. As with any medication, it is important to consult a healthcare professional to determine the appropriateness of using Abilify for individual circumstances. By understanding Abilify's mechanism of action, individuals and their healthcare providers can make informed decisions to optimize mental health treatment and improve overall well-being.